Thank you for joining us, CAN member, for this week's Need to Know. This week I'm accompanied by Larry because we want to go through some points explaining what our Cigna value-based contract is, and it's a milestone for our network to start. It's our first value-based contract that we sign with one of the major payers, the soon to be followed by Blue Cross Blue Shield
and United.
Yep. So we want to take a few minutes to explain this first contract so we can all be on the same page to be able to reap the benefits of a value-based contract.
Okay. First of all, let me just explain before I get into some of the details of the contract. Value-based contracting is the wave of the future. It's the only way that our physicians are going to be able to not only minimize the CPT coding and reimbursement value reduction that you bill and collect day in and day out, but all the payers are not going to be willing to increase CPT codes value moving forward. But what they are going to be willing to do is to share in the savings that we create by managing our patients in a more better outcomes with quality measures in a more cost-effective manner. So that is really where we're going, and we believe, and many people have done the numbers, this isn't just Larry talking, but we believe that we can improve your reimbursement 25 to 35% by participating in these value-based contracts moving forward. Our first contract was signed in a collaboration between the IPN network, the large integrated independent physician network here in Orlando, and CAN, our Clinical Alliance Network Pediatric Group. The contract was effective 4/1 last Friday, and we are very excited about that. It represents right now about 12,000 lives, and it represented just under 75 primary care / pediatricians that are primary peds. We have many more. We have almost 260 total primary care and peds in our overall CAN and IP network right now, but many of these peds or CAN members or IP members were either already in some other type of a Cigna collaborative accountable care model, and many of them with some of the hospitals or other entities, many with the Orlando Health Group. Our docs have the opportunity to move into our value-based contract after they spent 1 year with the program under the Cigna rules. So we are, in our newsletter that's going out this week, we are going to be resending the information that we're talking about on this video and the election to participate form. And if you're a primary care peds and you want to participate in this contract, whether you've signed, if you know that you have not signed the election to participate form and want to participate in this contract, please get that contract document back into Kathy as soon as you can. The way the whole thing is going to work is that we're going to be measured against, and in the PEDS world, 5 different measures that overall meet our quality measures as an entity in collaboration with IPN. And let me go through those. And I'm just going to read them right off the page here. First one is patients that had 6 or more well child visits with a primary care peds within the first 15 months of life. I think that's pretty standard because at those same points is when you do the immunizations for the patients.
Right.
All children that are 2 to 28 years treated with an antibiotic that presented for pharyngitis that had a group A strep test, and was there an antibiotic prescribed at that time?
Okay.
All children that are 3 months to 18 years with a diagnosis of upper respiratory infection that did not have a prescription for an antibiotic on or 3 days after the initial visit. That's another measure. And then patients 12 to 21 years of age that had one comprehensive well care visit with primary care or an OBGYN during the last 12 months of reported data. And then the last one is the biggest opportunity that we have as peds, and that's making sure that our mom and dads of these kids don't use the ER as their primary care, even on the weekend, and we develop some type of a program to get them to call into the primary care and not go to the ER for a bad cold on a weekend where you run up a $3,000 to $5,000 hospital bill when you could in fact run up a $125 primary care bill.
So this will be all about flagging those patients that are chronic, that you know that are going to pass the weekend.
Yeah.
And
it's about two things. It's about managing those chronic patients, as you mentioned, and also about wellness.
Right.
Making sure that we catch these kids. There's a Medicaid program out there called Healthy Start or Healthy Kids.
Right.
It's really about giving these children a healthy start. And that's obviously the goal of all of our primary peds anyway.
Well, as you know, and most of our members know that our intent is to clinically integrate all our doctors. So the next question that comes to my mind is, how is Cigna going to get that data to measure us against it?
Great question. I was actually going there. Every month, beginning in April, and we hope to have our first claims run by May 15th for April, Cigna will download all the claims on all the patients that we're responsible for. And by the way, our CAC, our Collaborative Accountable Care contract with Cigna, includes all commercial product lines. So if you aren't in certain product lines today, now you are, based on this program for shared savings. So we're going to get the claims on a monthly basis. We're going to break it down by practice and by NPI, and we will be providing selected reports for all of our peds and primary care going forward.
So to clarify this, you're saying that any insurance card, any patient that is, regardless of the employer that patient has, as long as their card says Cigna, they're in this program.
If they are assigned as a patient through the primary care doctor into our contract, we're responsible for it.
Okay.
Yeah.
So these are things that we monitor anyway because of the
it's
primary
basic.
care doctor.
Much of it is wellness, and much of it is HEDIS. And it's not anything that our physicians don't do day in and day out anyway.
And the ER for itself, let's define that, because I think there's a lot of cost control that we can do using independent ERs.
Let me mention, I think that's why it is urgent that we get our after-hour call center up, and we get that mobile app and integrate our HIA and our medical records with our call center, because that's going to be the perfect way that we can drive not only all answering service calls go through there, and our physicians are going to save money on the infrastructure cost of that, but now we're going to truly integrate, like you say, our patient records with our after-hours call center and have a big impact on ER visits.
Okay. So I think we've talked enough about that. More details to come as we will attach the agreement to the email.
And all the information that we've talked about in this video, we will also put in writing.
Okay. There's only 2 more things on my agenda for today. We are starting a billing webinar hosted by one of our doctors. It's basically, the first one is going to be about frequently overlooked codes that we could, starting 2016, are now billable, and how to maximize the reimbursements on those codes. We're going to go into details about modifiers and opening it up to many questions for our most experienced and dare taker billers that have taken the challenge this year of billing codes that in years past were denied. So we're seeing that we're getting reimbursed by many of those. So we're going to go through the most frequently used ones and the better reimbursed ones. And that's going to be on the 28th of April. at 3 p.m. and you will receive a flyer regarding that and hopefully an RSVP to that event. The third thing and last is our Pediatric Clinical Alliance Network TV network. You'll be called by a member of the medical media team, which we put up a television network, sort of like a closed TV network just for our patients. That they're going to put up a TV in your lobby. It will have a loop of videos that you could personalize to your practice. You can film your doctors, your nurses, your front desk talking about multiple things that you have interest to communicate to your patients. It's educational wise. It could be informing patients about specials or things that you're doing on a cash basis or any treatments that you have that are new, and about different medical advice. There's a small contract to sign and they'll explain it to you. It basically includes everything that the TV, the network, the installation, and it's absolutely free to all our members. And it's a network that the content of that network it can be controlled by the CAN network, so we can help educate our patients regarding healthcare and how to use an independent network of independent doctors, how it's going to save them on healthcare dollars. So you will be solicited by a group, and they'll have our letters and our recommendations and our contracts, so you could ask any questions. It's actually they will pay you for the use of that TV in your lobby. It's sort of like a leasing of the space in your waiting room for them to put up the network education and advertisers that are going to pay for that network. So feel free to call or write after you receive the contract and somebody that calls you, but it is called medical media. So without further ado, thank you, and please feel free to write or email to the admin email account if you have any questions regarding this video, and we'll be glad to answer those. Well, thank you, Larry, for answering those questions, and we look forward to another video about details about this.
Thank you.
Thank you.